The Galactic Council chamber fell silent as Ambassador Thexeril of the Varathian Collective delivered the grim news. A plague had emerged on the mining colony of Kepler 442b, a disease so virulent that it killed within 48 hours of infection. The pathogen, later designated as hemorrhagic necrosis syndrome, or HNS, showed a peculiar characteristic. It was invariably fatal to any medical personnel who attempted treatment. "The mathematics are simple," Thexeril's translator crackled across the assembly. "Every doctor who has entered a contaminated zone has perished. We calculate a 100% mortality rate among caregivers. The Varathian Collective has made the difficult decision to quarantine the entire planet. We estimate 340,000 colonists remain alive. They will receive food drops, but no medical intervention." Ruth Harrison sat in the human delegations section, her jaw clenched. A trauma surgeon with 15 years of experience in conflict zones across Earth and 3 colony worlds, she had seen suffering that would break most people. But this calculated abandonment, ignited something fierce within her. Beside her, Kyle Chen, a young epidemiologist who had joined the Human Medical Corps only 2 years prior, leaned forward in his seat. His hands gripped the armrests until his knuckles turned white. "This is unconscionable," Ruth whispered. "They're condemning hundreds of thousands to death without even trying." The Galactic Health Ministry representative, a crystalline being from Silicath Prime, added its perspective. "We have reviewed all available data. The disease appears to target the neurological systems of those experiencing elevated stress hormones, precisely the state medical professionals enter when treating critical patients. It is a perfect trap. Any being who cares enough to help will die. The only logical response is containment and observation." "Logical," Kyle muttered bitterly. "They keep using that word." 3 hours later, Ruth stood before the United Earth Medical Command via holographic link. The room was packed with doctors, nurses, paramedics, and medical technicians from across human space. She had sent out a simple message. "Volunteers needed for certain death mission. No one will judge you for refusing." 2,000 hands went up. Commander Sarah Okonkwo of the Medical Command tried to maintain her composure. "Dr. Harrison, I need you to be absolutely clear with these people. The aliens aren't exaggerating. This isn't a high-risk mission. This is a suicide mission. Everyone who goes will die." Ruth nodded slowly, then turned to face the sea of volunteers. "You heard the commander. The xenobiological reports are unambiguous. HNS kills 100% of active caregivers. You will treat patients knowing you're signing your own death warrant. Your families will lose you. Earth will lose you. I need you to understand." A grizzled combat medic in the back interrupted. "Doc, with respect, we understood the first time. When do we ship out?" Kyle stepped forward, his voice steady despite the tremor in his hands. "I've analyzed the data. We might not survive, but we can learn. Every day we're there, every treatment we attempt, every tissue sample we collect, it all becomes data. Maybe we can't save ourselves, but we can save the next planet. We can find a cure." A young nurse named Maria Santos raised her hand. "My grandmother always said that being human means helping even when it costs everything. Especially then. If we only help when it's safe, what kind of people are we?" The Galactic Council was stunned when humanity's response arrived. Not only were 2,000 medical professionals volunteering, but they were demanding immediate transport to Kepler 442b. "This is irrational," Ambassador Thexeril protested in an emergency session. "You're asking us to transport your people to their deaths." The human ambassador, a weathered diplomat named Marcus Webb, stood slowly. "No, Ambassador. We're telling you that we're going, with or without your transport. We'd prefer to arrive in time to help. But if you won't provide ships, we'll find our own way." "But why?" The question came from a dozen species simultaneously, their translators overlapping in confused harmony. Webb looked around the chamber, meeting the eyes and eye equivalents of representatives from 73 species. Because 340,000 people are suffering, because someone has to try, because if we don't, we can't call ourselves healers anymore. Humanity doesn't abandon the sick, even if trying to help them kills us. 48 hours later, the first wave of human medical teams landed on Kepler 442b. Ruth and Kyle were on the lead shuttle, descending through the planet's contaminated atmosphere toward the quarantine zone. The hospitals were overwhelmed, the corridors lined with the dying. The colonists, a mix of species from across the galaxy, looked up with hollow eyes as the humans arrived in their white hazmat suits, marked with the Red Cross of Earth's medical service. Ruth knelt beside a Varathian child, no more than 6 in human years, her carapace covered in the telltale lesions of advanced HNS. The child's parent watched helplessly from behind a barrier. "We're here now," Ruth said softly, preparing a sedative. "We're going to help." Kyle set up a mobile laboratory in what had once been a school cafeteria. Even as he worked, he felt the first symptoms: the headache, the vertigo, the slight tremor in his hands. He had perhaps 30 hours left. He needed to make them count. Around the colony, 2,000 human doctors, nurses, and technicians worked with desperate efficiency. They knew the math. They knew the outcome. But they also knew something the Galactic Council had forgotten: that some equations can't be solved with logic alone. By the end of the first week, 847 human medical personnel had died, but they had also stabilized 89,000 patients, collected enough data to begin understanding HNS's mechanism, and trained local volunteers in basic care techniques. Kyle, now barely able to stand, transmitted his final research notes to Earth. His hands shook so badly that Ruth had to help him with the keyboard. She wasn't much better off. The disease was claiming her too. "Did we make a difference?" Kyle asked, his voice barely a whisper. Ruth looked around the hospital ward. Where there had been chaos, there was now order. Where there had been despair, there was now hope. Patients who would have died alone were now receiving comfort care. Children were being held. The terrified were being soothed. "Yes," she said simply. "We reminded the galaxy what it means to be human." In the months that followed, human doctors continued to volunteer in waves. By the time a cure was finally synthesized, using data collected by Kyle and the first teams, over 1,400 humans had died. But they had saved 287,000 lives from 73 different species. The Galactic Council erected a memorial on Kepler 442b. It bore 1,400 names and a simple inscription that puzzled many alien visitors, but brought tears to every human who read it. They knew the cost. They came anyway. This is what humanity means. Ambassador Thexril stood before the memorial during its dedication, his translator rendering his words in perfect Earth standard. "We asked why you would do this, why you would sacrifice your own for strangers. Now we understand. You didn't do it for us. You did it because you couldn't live with yourselves if you didn't. In trying to understand humanity, we have learned that some species measure themselves not by what they can gain, but by what they're willing to give." He paused, looking at the endless list of names. "The Varathian Collective has much to learn from humanity. We thought logic and self-preservation were the highest virtues. You have shown us that compassion, even suicidal compassion, can change the galaxy." Far above, in human space, another 2,000 medical professionals stood ready. Not because they had to, not because it was logical, but because when someone needed help, humans answered the call. Always.